My name is Junior Hada with Funcphysio, and today we'll be talking about work from home back pain. Before we start this video, make sure that you press the like button, also the notifications as well, and please subscribe to our channel for a lot of great information just on how to take care of your overall health. How much do we really sit? In 2018, the Heart Foundation did a study stating that around 25% of Americans sit for around 8 hours a day, so in the entire workday. As well, 44% of Americans get little to no exercises at all. And lastly, for people that do get exercises, it's actually very minimal, averaging only about 20 minutes. Now, these were actually pre-COVID numbers, so as you can imagine, work from home being more popular more than ever, people are probably sitting for longer periods of time and more often as well. So let's take a look at what's happening with our body. In 2011, there was a very controversial study being done stating, is sitting the new smoking? Now, we all know that smoking is not great for our body, but is it just as bad as sitting? And vice versa, is sitting just as bad as smoking? If you look at the stats beside me, as you can see, sitting for prolonged periods of time is going to affect your chances of diabetes, cardiovascular disease, as well as death from any other thing that's going to affect your body. Now, it's very shocking as well, but today at Funcphysio, we want to see how our body changes orthopedically. Our bodies are amazing things that can create adaptations and help with everyday living as well. However, if those adaptations cause pain, we don't want that. One of the first things that does happen in our body if we sit for prolonged periods of times, it actually shortens our hamstrings. And that may seem harmless, but that actually changes our pelvis alignment. So I have here a pelvis, and if we sit for a prolonged period of time, our hamstring is going to pull our pelvis posteriorly and cause a posterior pelvic tilt. In layman's term, what it means is that it's going to cause you to slouch. It may seem harmless, but what it actually does is that when we do posterior pelvic tilt, it's going to damage our annulus. Our annulus is in between the two vertebrae, just helping with shock absorption. So every time that we do posteriorly tilt, as you can see here, there's more compression on the anterior side of the annulus. The second thing I want to talk about is that the opposite can occur as well. If we do sit instead of slouching, but more forward, what can happen is that it actually causes our pelvis to become anteriorly tilted. And what that means is that if you look on the back side, when you do anterior tilting, it's going to add compression to these joints here. These are called facet joints. And a facet joint is very important for our spine health, and if those get damaged, it can cause back pain too. And lastly, if we do sit for prolonged periods of time, it's actually going to change our muscles as well. The muscles that were meant for stabilization may not be firing or working well, and the muscles that we're supposed to be using for movement may actually step in and do the stabilization for us. And those compensations in the long run can cause low back pain and issues down the line. So now that we talked about what causes pain, we want to tell you what you can do about it to make it better. So one of the first things, the very easiest thing, is simply get up. When we sit, we actually add 10% more pressure onto our spine, and if you actually slouch, you're actually adding 2 to 3 times more pressure than what you would do when you're standing up. And finally, when we do get up, we want to get up every around 20 to 30 minutes, just to give your back a little bit of a break from sitting. So one of the things that we get asked most about is standing desks. Although I do agree standing desks are very, very good, one of the things is it's poor compliance. So people that do get them don't use them as much as they should. The other thing is, there has been a study done on standing desks where it was saying that if you don't have low back pain and start using it, you might not be able to get as much benefit. However, if you do already have back pain and use a standing desk, there has been studies showing that it has been beneficial for an individual. I do know that this is very specific and it's only been one study. However, if you do feel that it's going to help you, motivate you to get up more, standing desk is a great option as well. When sitting in an unsupported position, such as sitting on a stool, so not having a back here, what we want to do is make sure that our knees and our pelvis are in good alignment. Now, what is good alignment? I'll show you here. When we have our hips higher than our knees, that actually promotes bringing our pelvis forward. However, if we do have our seat so that it's lower than our knees or roughly the same height, what it does, it promotes posterior pelvic tilt. As we previously mentioned, when we do have a posterior tilt in our pelvis, that can cause damage to our annulus. So now let's review. Going back up, if we do bring our stool back up a little bit higher, our hips are higher than our knees, and what that's going to promote is an anterior pelvic tilt. Not too excessively so it won't cause damage to our facets. However, if you do feel like that you're slouching a little bit more, even though that the pelvis is higher than the knees, try and scoot a little bit onto the front side, making sure that we have our weight firmly placed on our feet. If you still feel like you're still slouching, try and bring your pelvis a little bit more anteriorly by dropping one leg to the side. I know that this is an exaggeration. You may feel like that you're going to fall off to the side, but just try and find a comfortable position where you're still seated on the stool and one leg behind. Because what that does is that bringing one side forward, it'll still help bring the other side forward as well, giving yourself a better neutral pelvis. So just like this, but making sure our weight are onto our feet. So the basic principle is still the same. We want to be sitting so that we have our feet firmly on the ground and that our pelvis is going to be a little bit more anteriorly tilted, or as well, trying to make sure our pelvis comes forward, so we're kind of leaning forward. One way we can do that is we can take a towel, roll it up, and what you're going to do is, if you notice my pelvis here, that it's rotated posteriorly, we want to bring it forward by placing the towel a little bit behind, just rolling it up here, just behind us here. As you can see, it's harder for me to slouch back this way and promotes me to tip my pelvis forward. As you can see, this creates a little bit of a gap here, but that's just because this chair was designed for you to sit back, when we actually want to be doing is sitting up straight. And I think that's the difference most people don't understand, is that we're not sitting back, we're sitting up straight. We have our weight forward, feet firmly on the ground. If I were to try and come up and lift your legs up, I shouldn't be able to, which I can't lift my legs either. But if I sit here, the weight is off my legs, and it's much easier to lift my legs. So that's one test you can do. So the last little point that we want to give is, now that you have your towel here for your pelvis, which will promote you to have an anterior tilt in your pelvis, you can actually try and fill that gap in the back by putting more towels as well. So what we're trying to do is, we're not trying to sit back into our seat, but we're trying to bring our seat to press up against our back. So you can fill this gap with a towel, with a pillow, with anything that you'd like to promote your body going more anteriorly. I think in society we just provided more chairs, or designed more chairs for you to sit back in. Instead, we should be sitting upright in. So if you do this, you'll have a more comfortable sitting position that's actually good for your spine as well. One of the most underrated things that we can do for our low back is actually stay hydrated. When we don't drink enough water, what it makes is our tissues become more brittle, and therefore it can cause more damage in our body. For those that do drink water, if you're 19 years or over and a male, drink around 130 ounces, and for females around 95 as well. So drinking that water will help with your low back pain. So the other thing that we can do is definitely recover better. What that means is improve our sleep. If you do have a mattress that's 5 years or older, time to get that thing out of there. Get a new mattress, so that'll help you with your sleep. As well, for people that sleep on your stomach, I have some bad news. Try and change your sleeping position. Because if you remember what we previously talked about, is that it changes the angle of our pelvis. If we sleep on our stomach, what that happens is that it brings our pelvis into an anterior tilt. Now you can imagine on the back side, it's causing those pressures in the facet joints once again. So if you do sleep on your stomach, try and find a way that's more comfortable to sleep. Another important thing for our low back is exercise. Exercise, we want to do roughly around 30 minutes a day. And some people may think of it as a chore, but think of it as an investment for your future health. Like all investments, it just takes a little bit each time, and with compound interest, your body gets some benefit over the future. I'm going to present to you the standing iliopsoas stretch. So for this exercise, you're going to need a chair, or at least something roughly the same height as a chair. When we get started, we're going to go ahead, face our chair, placing the right foot on top here, making sure we're firmly planted. Next, what we want to make sure is just having our pelvis in the right alignment. For this, what we want to be doing is what's called a posterior pelvic tilt. What that will look like is this top portion of the pelvis will rotate backwards, and then the bottom portion of this pelvic would rotate forward, so it's kind of rocking back a little bit. And for this, you can go ahead and just squeeze your glutes. And as you can see, from here to here, the rotation of the pelvis. And what this does is you'll slowly feel a stretch in the front of your thigh here. Standing up tall, and you can place both hands onto our knees. Go ahead, take a deep breath in, and breathe out. And good. You're going to repeat it for 5 breaths, and then we're going to introduce you the other section of this exercise. So when we're doing this exercise, you would notice that my left foot was turned straight, staying straight. And next, what we want to be doing is turning our toe in, and one of them turning our toe out as well. So to refresh, we're going to go ahead, this time having our toe in, having our foot on top. Same thing, rotate that pelvis posteriorly, place your hands on your knees, standing up tall, breathing in, and out. Remember, repeat that 5 times as well. After you're done doing the toe in version, go ahead and do the toe out as well. So this time our foot is a little bit laterally. Foot is on top here. Take that pelvis, rotate it backwards, hands on knees, standing up tall, breathing in, and out. Once again, 5 breaths. We may be tempted in this exercise to lean forward, but what that does is, I can see with my low back, it starts to arch a little bit. And that can cause some issues with the pelvis, with the low back as well as the pelvis. We want to make sure that it stays posteriorly rotated and to avoid any of those issues. As we previously mentioned, one of the most important things for our health in sitting is the alignment of our pelvis, which means that we have to work on the muscles that surround the pelvis. So we took care of that with the hip flexor. Now let's see what we can do with the hamstrings. For this exercise, you're going to need a chair, and you're going to go ahead and put your foot on top here. I don't want you rounding your back, but I want you to push this back so that you're bending at the hip joint. And then you're going to feel a stretch all along here, up to here as well. And then slowly back, and pushing back as well. If you do want to hold it, 30 seconds, 3 times the leg, and then you can switch to the other side. One of the things is, majority of the time when we do stretches just leaning forward, you feel the hamstring stretch probably on the distal or the further end of the hamstring instead of the proximal or closer end. So for me personally, just from my preferences, what I've seen as well, this one's pretty good, just trying to get the proximal hamstring stretch here. Next exercise, what you're going to need is a mat just placed on the ground. We're going to be doing bridges, a very famous and simple exercise, but sometimes it can be done incorrectly. So let me teach you how to do it correctly. For this exercise, what you want to do is have your feet shoulder width apart, knees bent, and just lying on the ground. We want to make sure that our pelvis is in our optimal position. So if you remember the posterior pelvic tilt, what we're going to do is rock our pelvis back. You would know if you've done this correctly if you check by placing a hand underneath. There should be a little bit of a space where your natural curve of your spine would be. So think about reducing that curvature by pressing the low back and making sure it doesn't move from that position. Once you're in this position, you're going to try and think about not pushing your hips up, but think about pushing your legs out and away. Now what that means is that some people, when they think about doing a bridge, they think about trying to get their hips high as possible and using every single muscle, like or even our hamstrings, to promote hip extension. Instead, think about pressing your heels down, pushing your knees out and away as far as possible so that your hips come up naturally. You should feel the squeeze in the glutes here at the very top and then slowly come down as well. Some people, what they try and do is they dig their heels as hard as they can, and which will cause cramping or issues in the hamstrings. So once again, posterior pelvic tilt, push your knees out and away, and then come back down as well. So think about trying to bring your knees this way so that your pelvis naturally comes up off the ground. So those are 3 simple exercises that you can do at home that are very good for your low back. Although these aren't revolutionary and you may have seen them online before, it's not necessarily about how complicated or how amazing these exercises are, but it's more about the consistency, the dedication, and how well you're going to do them. If you think about it, a simple program done well, done consistently, will far outweigh the benefits of doing something that's complicated, revolutionary, and foolproof if you don't do them at all. So all those exercises, we can't guarantee you they'll get the best results ever. We do notice that patients and ourselves that do these exercises benefit for low back pain. Once we reach that level where it seems like nothing's really working, it's definitely time to go see a physical therapist. So with a physical therapist, sometimes our low back pain may be connected to something else as well. Sometimes our ankles, knees, hips, even sometimes our upper back, neck, who knows, right? Somewhere down the line there may be issues that's causing the actual back pain as well. And we will never know if we don't go see a physical therapist or a health expert. What the physical therapist can do for you is create a specific program for your specific needs instead of a catch-all net that you may see online as well. So for many years you may be suffering from back pain, and many years you have been creating the same habits as well. So change is not overnight. And one of the things is low back pain can be chronic problems. And if that's the case, we need chronic solutions. Now what that means is that if you've been having this your entire life, you may have to do some habits that you may have to have for the rest of your life from now on in. Now don't think of it as a bad thing, think of it as a good thing. Because what you're doing is putting good habits in for the rest of your life that's going to help you with your future, right? For example, if someone is in debt right now, they're trying to get out of that debt, you telling them save money a little bit every day shouldn't make that person upset. It should actually excite them, because eventually saving that money will eventually add up, and over time they will have these savings, they'll have these extra funds that they could use later on as well. Just because they got out of debt shouldn't mean that they stopped their savings. Same thing with exercise as well. Just because we give you some of these exercises, just because you try them for a while and your low back gets better, we don't want you just stopping there. We want you to enjoy life. We want you to have the great life that you envision for yourself, not only in a physical sense, but in all other aspects. So by having these habits, hopefully you get those benefits as well. So I hope you enjoy our video for today on work from home back pain. This simple little video can get you on the right track to helping with your back pain. But if you do need more information or have any questions as well, please follow us on social media on Facebook as well as Instagram. The links are below, as well as our homepage. The link is below as well.